Hey everyone, welcome to this high-yield explainer. Let's dive right in. Today we're unpacking a seriously powerful class of antibiotics known as the fluoroquinolones. Whether you're prepping for a pharmacology exam, gearing up for clinicals, or just want to deeply understand how these medications act as clinical superheroes, you are in exactly the right place. We're going to break down the science, the risks, and the rules of this vital drug class.
Here's the roadmap for our explainer. We'll start by meeting the fluoroquinolones, then look at how they work, unpack the major risks and side effects, and wrap up with patient rules and education.
All right, Section 1. Meet the fluoroquinolones. Let's get an overview of the drug class.
So fluoroquinolones are a broad-spectrum antibiotic class, but you know the ultimate cheat code for spotting them in the wild is their naming convention. If you see the suffix floxin at the end of a drug name, like Ciprofloxacin or Levofloxacin, boom, your brain should immediately flag it. That's your dead giveaway right there.
Because they cast such a wide net, going aggressively after gram-negative and even some gram-positive bacteria, they're incredibly versatile. I mean, we're talking about treating urinary tract infections, respiratory infections, GI bugs, and skin infections. Basically, when a patient comes in with a really stubborn infection in one of these body systems, this drug class is often the weapon of choice.
Moving right along to Section 2, how fluoroquinolones work. Let's look at their mechanism of action.
It's genuinely fascinating how these drugs actually tailor their attack based on the specific type of bacteria they encounter. It's not just some blind assault. For gram-negative bacteria, the drug zeroes in on and completely inhibits an enzyme called DNA gyrase. But if it's facing gram-positive bacteria, it shifts tactics and inhibits an entirely different enzyme, topoisomerase 4. It's a really specific, two-pronged approach to breaking down those bacterial defenses.
And all of this builds into a perfectly lethal chain of events for the bacteria. Step 1. The drug targets either that DNA gyrase or topoisomerase IV, depending on the bug. Step 2. By knocking out those crucial enzymes, it completely blocks DNA replication inside the bacteria. And finally, Step 3. Stripped of its ability to replicate, the bacteria dies. The drug doesn't just slow the infection down, it achieves a full bactericidal effect, completely eliminating the threat.
Which brings us to Section 3, major risks and side effects. Let's talk about safety monitoring.
Now, every powerful tool has some collateral damage. And surprisingly, an antibiotic meant to clear an infection can actually mess with a patient's heart rhythm and their brain. Fluoroquinolones can cause a long QT interval. So if your patient is taking this alongside other QT prolonging drugs, like amiodarone for instance, that risk really multiplies, and you absolutely must monitor their ECG. And on the neurological side, particularly in our elderly patients, you've got to be on high alert for dizziness, headaches, and sudden confusion. These aren't just general signs of aging or fatigue, they are direct neuro effects of this medication.
Then there's one of the most bizarre and honestly dangerous side effects, which involves the musculoskeletal system. It is wild to think that a drug meant to cure a stomach bug could actually cause a tendon to snap, but older adults taking these antibiotics are at a significantly increased risk for an Achilles tendon rupture. And get this, that risk spikes even higher if the patient is concurrently taking corticosteroids. It's a totally unexpected, yet highly critical side effect that absolutely has to be on your clinical radar.
Beyond the heart and tendons, there are a couple of severe systemic risks to watch out for too. Like a lot of potent antibiotics, wiping out the bad bacteria can unfortunately wipe out the good gut flora as well, and that leads to an increased risk of a C. diff infection. On top of that, these drugs cause intense sun sensitivity. And we're not just talking about getting a mild sunburn during a quick walk outside. The phototoxicity is severe enough that you actively have to manage the patient's environmental exposure.
All right, our final stretch, Section 4, patient rules and education. Let's talk about protecting our patients.
When you're educating patients on this, there is a stark contrast between what to encourage and what to absolutely avoid. First, we need to strongly encourage fluid intake. Especially with a drug like ciprofloxacin, patients literally must drink plenty of water to prevent crystalluria, which is the formation of crystals in the urine, and that can lead to severe kidney injury. On the flip side, patients must avoid taking this medication with antacids, calcium, iron, or dairy products. Why? Because these substances actually bind to the drug and drastically reduce its absorption, meaning the antibiotic won't even do its job.
Because of that severe sun sensitivity we talked about, you've got to instruct patients to wear sunscreen and just completely avoid tanning boosts, period. And regarding that bizarre Achilles tendon rupture risk, you need to give them highly specific instructions. Tell them to immediately report any pain in the Achilles area
any swelling, any sudden snap feeling, or even a sudden decrease in mobility.
Finally, we have to look at the major red flags. The hard, non-negotiable contraindications here are children and pregnant individuals. The core reason is developmental. In growing children and developing fetuses, fluoroquinolones carry a well-documented risk of causing bone and cartilage problems. So this is a strict safety boundary that you simply cannot cross.
So as we wrap up this explainer, I want to leave you with a bit of a provocative question. Fluoroquinolones offer incredibly powerful, broad-spectrum coverage to eliminate aggressive infections, but are you prepared to safely manage their complex side effects? Because mastering this material isn't just about knowing how an antibiotic kills a bacteria, right? It's about the delicate balance of maximizing healing while anticipating and preventing harm. Internalize those warning signs and carry this structured knowledge right into your practice. Thanks so much for learning with me today, and I'll catch you in the next explainer.